Alright, so today we're going to be looking at doing an ankle assessment after an injury that we suspect to have an ankle inversion sprain. In with a fracture screen, just because the traumatic incident was that another player stepped on the player's foot, so we want to just rule out any possible fractures. So the first thing that we're going to do is observe the leg and ankle, comparing both sides, looking for any atrophy, also abrasions, bruising, any sort of swelling, maybe any lumps or bumps within the ankle, and then if that's all okay, then we can perform into the 4-step test. So we'll have our patient step up and go into, just instruct them to walk, and we're just going to see their ability to actually step. It doesn't matter if they can limp or how bad the limp is. We're just seeing if they can walk 4 steps without saying they can't do it. So after we get into that 4-step test, then we're going to get into some palpation of some structures. Within the palpations, we're going to be looking at the tibial crest and the fibular crest, looking about 6 centimeters above the medial and lateral malleolus. Again, we're just looking to see if it elicits any pain. And then we go on to the medial and lateral malleolus, the navicular, the cuboid, and then the styloid process of the 5th metatarsal. Within those same locations, we're going to do percussion. You can use either your fingertips or a reflex hammer. Again, just looking to see if that elicits any pain. Following that up, we're going to do percussion. Same spots, seeing if it causes any pain.
And also the torsion test. And next we'll just move through some range of motions. We're going to have the patient bring their toes to their head on both sides. Just checking for any decreased range of motion in each of these movements. So moving toward the head into dorsiflexion, down into plantar flexion, into inversion, and into eversion. Again, with all these tests, we're just going to make sure we note when the patient has pain and continuously ask them when they are feeling that pain. We'll just move into some orthos. So we're going to start with anterior and posterior drawer.
You want to make sure that you do these at 0 and also 28 degrees. So at 0, you'd be here. And then we do at about 20 degrees. That's going to be done there.
Okay, we'll also do inversion and eversion.
Again, these can be performed at 0 and 20. And an important factor of this is like watching your hand contact, because we want to see what's actually being stressed when we perform these. So just because our hand contact is on something, it could cause a positive finding. So we just want to make sure when we do these tests that our hand contacts aren't really stressing any or loading any of those structures that we're assessing.
We're going to move into the Kleiger's rotational stress test, specifically assessing for higher ankle sprains. Into some muscle testing. Since we have a history and have noted that it's likely an inversion sprain, we're going to work on the everters of the foot as well as the dorsiflexors and flexors. So go ahead and start with the everters.
We'll start with the everters. For this will be peroneus tertius. So we're going to have our foot dorsiflexed and everted, and we're just going to try to push it down and back to the middle. Our peroneus brevis is just going to be neutral foot and just evert it, and we're going to try to push it to the middle. And then for longest, it's going to be plantar flex and evert it, and we're going to try to kind of pull it out of that position. Correct. And then our next one is going to be our tib posterior. This one we're going to start our foot down into plantar flexion and inversion, and we're going to try to push it up into eversion and dorsiflexion. And then the next one that we wanted to assess was our tib anterior, so we're going to start into dorsiflexion and inversion, and then we're going to try to pull that foot out of that position.
And again, we're just noting any pain with any of these. Likely in this case scenario, there'll be pain with the everters and potentially weakness, although it may or may not be there since it's just a mild sprain. Next, we're going to move into a little bit more of an in-depth soft tissue palpation. Specifically palpate the ligaments around the malleoli and locate where the pain is specifically.
So a few key ligaments that we're going to be looking at within the ankle are going to be our talus curl and calcaneal fibular. So with these, we have an anterior talus curl right here on the lateral side, calcaneal fibular here, and the posterior talus fibular or calcaneal there. After we go assessing those ligaments, then we can also just assess some of the musculature within those tendons from the everters of the foot. And then we can go on to the medial side looking at some other ligaments called the deltoid ligament, which is going to be just below the medial malleolus, kind of connecting to the talus right here, and then also the spring ligament will be coming right below that to the navicular. We can assess those ligaments. And in addition to, we'll just follow up with some other musculature tendons, just from like our flexors. I'll be wrapping down underneath our medial malleolus, just checking for any tenderness within those structures. Could just go into more depth, just looking at some joint plays. So the first one we're going to be looking at is within the talus curl joint. This is kind of similar to the orthos that we did before. We're just going to be assessing for anterior and posterior. And then that can also be form 0 and 20. And then we can go into just like long axis distraction. And then we're going to look at our subtalar joint. So preferably I like to be sitting in between. And I'm just going to kind of do a little bit of long axis distraction. And then from there I'm just going to kind of go into either eversion or inversion. And then I can also go into just kind of like pushing the calcaneus up towards the foot, like the toes, for anterior glide. And then I can also push it down for posterior glide. And then from there I can also go into just like rotations of the calcaneus. After that, I want to be assessing the talonavicular and also the talocuboid assessment joints. So within those, we can go into superior and inferior glides. So I'll just be pulling up and pushing down. You can do the same thing with the cuboid, pushing down and pulling up. Within those two, we can also go into medial rotations and lateral rotations. And then we can get more specific at looking at the metatarsals here. So within all of these, if we want to go into depth, we'll just kind of pin all of them and just take our thumb, or like thenar, and just kind of move it superiorly and inferiorly. And we can also get some rotation with those. We can just keep working our way down, assessing the movement within each of those. And then the last few structures that we're going to check in the foot is going to be with our phalanges. So I'm just going to demonstrate on the great toe that there's like 8 joint plays that you can do with this that you can apply to all the rest of the toes. But with all these, you always want to do long axis distraction. First one's just going to be kind of superior glide and inferior glide, where you're just kind of pulling the toe up and down. Next, we're going to go into tilts. So with the tilts, we're just literally pivoting around the joint. So that'd be for inferior and superior tilt. We can also go into medial and lateral tilt, where we're just going to pull it from one side to the next. And we can also glide side to side. And then we're going to check rotations, so we can go medial rotation and lateral rotation. Again, all those can be applied to the rest of the toes, and that's all we're going to show for joint place.